Hello everyone. So now we will discuss about the kinesiology of thoracic spine. We have completed the cervical spine where we discussed the brief anatomy. We discussed about the osteokinematics, arthrokinematics and kinetics of the cervical vertebra. In anatomy, we also discuss about the typical and atypical vertebrae. Similarly, we have atypical and typical vertebrae for thoracic spine. First, let's discuss the basic anatomy briefly. It has how many vertebrae? Thoracic spine has 12 vertebrae, T1 to T12. It is more rigid compared to the cervical and lumbar vertebrae. It has less mobility because of the connection of ribs to this vertebral spine. It contributes in protection of heart, lungs, great vessels. When we view from the lateral side, it is kyphotic. It is about 20 to 40 degrees of kyphosis. In young adults, women have less kyphosis in the thoracic spine than the males. These are basic anatomy. Similar to cervical vertebrae, thoracic vertebra has typical vertebrae and atypical vertebrae. So typical vertebrae, that is the features of the vertebrae are same for T2, T3, T4, T5, T6, T7 and T8. So T2 to T8 they are similar. So what are the features that are similar for typical vertebra? The vertebral bodies are heart shaped with large anterior posterior dimensions. You can see it has a large anterior posterior dimension and it is a heart shaped. Size increases downward, so T4 is larger than T2. So size increases down the spinal column. Demifacets are present. There are two demifacets. You can see in the picture two demifacets. Upper demifacet and lower demifacets are present at the lateral borders of each typical vertebra. Some of the other features that are same for this typical vertebrae are that pedicles are short. It is about 6 to 8 mm arising from the posterior lateral part of the body. So these are the pedicles that arises from the posterior lateral part of the body. It is short. It is about 6 to 8 millimeter. Superior articulating process arises from lamina near the pedicle. So these are the superior articulating facets. It arises from the lamina near pedicle. So this superior articulating facet articulates with the inferior articulating facet of the upper vertebra to form the facet joint. The inferior articulating facet arises from the lateral end of the lamina. You can see here or this area. So these are the inferior articulating facet of the typical vertebra. It arises from the lateral end of the lamina. It is same for every other vertebra, but the difference between the atypical and typical is that typical vertebra has two demifacets in the lateral part of the body and it has one costal facet on the transverse process. So as we discussed, the faces, the superior articulating facet of the inferior vertebra and inferior articulating facet of the superior vertebra forms the facet joint or the epiphyseal joint. The spinous process is long, directed inferiorly and posteriorly. You can see the spinous process is long, it is directed inferiorly and posteriorly. Transverse processes project laterally and posteriorly from the pedicle and lamina junction. It is about 4 to 5 centimeter in upper thoracic spine and decreases as it moves downward. There is a costal facet found in the transverse process. We already discussed that. This is the costal facet for articulating with the tubercle of the rib. These demifacets are present for articulation with the head of the rib. These are some of the features for typical vertebrae. Now coming to atypical vertebra, that means each vertebra is unique in its feature. That is, T1 is completely unique compared to other thoracic vertebrae. T9 is unique. T10, T11, T12. They have unique features compared with other thoracic vertebrae. So what are the unique features of T1? The T1 has two costal facets in the lateral part of the vertebral body. It has one complete facet, that is circular, and one demifacet. The superior facet is circular, the inferior facet is demifacet, that is incomplete facet. And it has one costal facet on the lateral part of the transverse process. So the circular facet, the superior circular facet, articulates with the first rib. The unique feature of T1 is also that the spinous process is slightly horizontal compared to the typical vertebrae. The superior and inferior articulating processes are also slightly horizontal. You can see this inferior articulating facet and superior articulating facets are slightly horizontal. Transverse processes are long and it is slightly thick. These are the unique features of T1 vertebra. Now coming to T9, T10, T11 and T12. T9, T10, T11 and T12 has only one costal facet on the lateral side of the body. T9, it has a demifacet. T10 has a complete facet. T11 has a complete facet and T12 also has a complete facet, costal facet on the lateral aspect of the body. Whereas T9 has a demifacet as well as a costal facet on the transverse process. T10 has a complete facet and a costal facet on the transverse process. So T9 and T10, what is the difference? T9 has a incomplete facet, that is demifacet, on the lateral aspect of the body, whereas T10 has a complete facet. Now what is the difference between T11 and other vertebrae? T11 has a complete facet but doesn't have a costal facet on the transverse process because rib 11 is a floating rib, therefore it doesn't have any articulation with the transverse process. And T12 also has only one facet and it doesn't have a facet on the transverse process. T12 inferior articulating process is directed laterally. So that is the unique feature of T12. The inferior articulating facet is directed laterally rather than anteriorly. So you can see the difference. T1, it has two facets on the lateral aspect of the body. T9, T10, T11 and T12 has only one. T9 has a demifacet on the lateral aspect of the body, whereas T10, T11, T12 has complete facets. T10 has a complete facet as well as a transverse costal facet, but T11 and T12 doesn't have a transverse costal facet. T12 is unique compared to T11 because of the inferior articulating facet which is facing laterally. Moving on to arthrology, the main joint of the vertebral column is the epiphyseal joint, which is also present in the thoracic vertebra. In this area, you can see the marker epiphyseal joint, which is formed between the inferior articulating facet of the superior vertebra with the superior articulating facet of the inferior vertebra. So this epiphyseal joint or facet joint gives the maximum movement in the vertebral column. The other joints which are present in thoracic vertebrae and it is not present in other vertebral column, lumbar vertebra and cervical vertebra, is the costovertebral joint. So between head of the rib and the body of two adjacent vertebra and the disc, the costal vertebral joint is formed. So these two demifacets, you can see here, the superior demifacet of T7 and the inferior demifacet of T6 will give attachment to the head of the sixth rib. So that is the costovertebral junction. And the tubercle of the sixth rib will have attachment with the costal facet of the transverse process of T7. Rib 1, 10, 11 and 12 articulate with numerical bodies. Next joint is the costo-transverse joint. We discussed in previous slide that the tubercle of the rib, here you can see the tubercle of the rib will articulate with the costal facet of the transverse process to form the costo-transverse joint. Rib 11 and 12 doesn't have this joint because the rib 11 and 12 are floating rib, and there is no costal facet on the transverse process of T11 and T12 vertebra. Coming to kinematics, the movements occurring are flexion extension, rotation, and side flexion. And we also have to remember there is a natural kyphosis of 40 to 50 degree. Now let's move on to osteokinematics, that is movement of the vertebral bones, that is thoracic vertebral spine. For this we have to remember 3 points. We have discussed this in cervical vertebral column. We have to remember 3 points, that is movement occurring at the joint. Next is planes and axis where the movement occur, and third point is the range of motion. So here we have movement occurring is flexion and extension, axial rotation, and lateral flexion. Flexion and extension occurs in sagittal plane and coronal axis. Axial rotation occurs in horizontal plane, vertical axis, and lateral flexion occurs in frontal plane and sagittal axis. The range of flexion at the thoracic vertebral column is 0 to 30 to 40 degree. Range of extension is 0 to 20 to 25 degree. Range of axial rotation at the vertebral column is 0 to 30 to 35 degree, and range of motion of lateral flexion at the vertebral column is 0 to 25 to 30 degree. These are the osteokinematics of vertebral column. Now moving on to arthrokinematics of the thoracic vertebra. It is similar to cervical vertebra, just the range of movement is less compared to the cervical vertebral column. The arthrokinematic, that is sliding of the facet joints, are in similar direction to the cervical vertebral column. Now what was the direction of the slide for flexion of the cervical vertebral column? It was superiorly and anteriorly. Similarly, out here also during flexion of the thoracic vertebra, the inferior articulating facet of the superior vertebra will slide superiorly and anteriorly on the superior articulating facet of the inferior vertebra. During extension, that is when the vertebral body moves posteriorly, the inferior articulating facet of the superior vertebra will slide posteriorly and inferiorly on the superior articulating facet of the inferior vertebra. It is similar to cervical vertebral column. During lateral flexion, again it is similar to cervical vertebral column from C2 to C7. During lateral flexion to the right, the same side inferior articulating facet will slide posteriorly and inferiorly on the superior articulating facet of the inferior vertebra, whereas the opposite side inferior articulating facet of the superior vertebra will slide anteriorly and superiorly on the superior articulating facet of the inferior vertebra. The orientation of the facet joint was 45 degree for cervical vertebra, whereas for thoracic vertebra it is 60 degree. Now for rotation, inferior articulating facet of the superior vertebra, both the sides will slide towards the left side if you are rotating towards the right side. Again I'll repeat, if you are rotating towards the right side, both inferior articulating facet of the superior vertebra will slide left side on the superior articulating facet of the inferior vertebra. Hello everyone. Welcome to Biomechanics class. Last class we discussed about the Arthrokinematics, Osteokinematics and some anatomy of the thoracic spine. So today we'll discuss kinetics or osteokinetics. That is the compressive and distractive force acting on the vertebral spine, especially the thoracic vertebral spine. So during flexion, which part of the vertebral spine, thoracic vertebral spine is compressed and which part is getting elongated. Before knowing that, we already know due to the posterior concavity of the thoracic vertebral spine or kyphotic structure of the thoracic vertebral spine, there is already a compressive load over the vertebral bodies. And also the COG passes anterior to the vertebral spine, creating more compressive load on the vertebral body of the thoracic vertebral spine. The load increases caudally, that is 9% of the body weight is overcome by T1, whereas 40% of the body weight is causing compressive force at T12. 76% of the load is transferred through the body and disc complex, that is out of 47% of the body weight at T12, 76% of that body weight is transferred through body and disc complex, whereas remaining weight is transferred to the pillars of the vertebral spine, that is epiphyseal joint pillars, lamina and pedicle. Now, more flexion of the thoracic vertebra increases the compressive force anteriorly on the vertebral body and the disc, whereas there will be distractive force on the posterior structures, that is the facet joints. Facet joints will get elongated, it will separate from each other, as well as the spinous process will move apart from each other, but anteriorly there will be compressive force on the vertebral body and the disc. So what are the forces that limit excess flexion? The flexion can be limited by the tension that is created in the posterior connective tissue, which are mostly ligaments. So the first ligament and the important ligament which prevent excessive flexion is the posterior longitudinal ligament, which we have already discussed for cervical vertebra. So these ligaments are similar to cervical vertebra. It is same. It prevents flexion of the vertebral spine. Here is the ligament which you can see, the longitudinal ligament which is just posterior to the vertebral bodies. Next ligament that prevent flexion is the capsular ligament which covers the epiphyseal joint. It prevents rotation, side flexion as well as the flexion of the vertebral spine. Next structure which prevents flexion is the well developed ligament, that is the ligamentum flavum, which is between the lamina of the superior vertebra and the inferior vertebra. So this prevents flexion as well as side flexion. Interspinous ligament, which is present between the spinous process, as we have discussed for cervical vertebra, it prevents flexion. Supraspinous ligament, which are running through the tip of the spinous process of the thoracic vertebrae. So these ligaments prevent flexion. The bilateral intertransverse ligament, which are present between the transverse process of the superior vertebra and the inferior vertebra, this ligament also prevents flexion. Now coming to compressive and distractive force during extension. So during extension, the compressive loading is on the posterior aspect of the vertebra, that is the pillars and the spinous process of the vertebra, whereas there will be distractive force anteriorly, which will be separating the vertebral body from each other, creating more space for the intervertebral disc to shift anteriorly. What are the forces that limit excessive extension? It is the anterior longitudinal ligament, which is the only ligament that prevents excessive extension which is situated anterior to the vertebral body, as well as the approximation of the spine of the vertebrae will also prevent excessive extension. The forces that limit lateral flexions are the impact of zygofascial or facet joints, its capsular ligaments, limitations imposed by the rib cage itself. The forces that limit excessive rotation are the shearing force which is created over the sternum, impact of the facet joints, its capsular ligament, limitations imposed by the rib cage, ligamentum flavum, transverse ligament. Here the unique thing is which limits excess rotation is the rib cage, the presence of rib cage, which restrict movement of the thoracic spine. Due to the change in the orientation of the zygofacial joint or the facet joint at T11 and T12, the amount of axial rotation is decreased in the lower part of the thoracic spine, because at the level of T11, T12, the orientation of the facet joint or the epiphyseal joint is approximately 90 degrees to each other, which prevents rotation. The trabecular systems which we have already discussed for cervical vertebra, which will be remaining same for all the vertebral spine. It has three types of trabecular system or arrangements, which is vertical, superior oblique and inferior oblique. So vertical trabecular system prevents the compressive force, whereas superior and inferior oblique prevents the torsion and the shearing force. The lever system in the thoracic spine is same as cervical spine. It is the first class lever where the fulcrum is the articular facet joint. You can see number 1 here, that is the fulcrum facet joint or the epiphyseal joint. The resistance is the vertebral body and the intervertebral disc where the axial load is borne. That is the body weight which is acting downward. This is the load which will be overcome by the effort created by the posterior muscles of the vertebral spine, which is mainly the erector spinae, multifidus, etc. So what are these muscles posteriorly which acts as an effort? The main muscles are the erector spinae muscle, which is grouped into three groups, that is longissimus group, iliocostalis group and spinalis group. You can see in the picture we have three longissimus, longissimus capitis, longissimus cervicis and longissimus thoracis. So these muscles create extension as well as side flexion and rotation. If it is contracting unilaterally, it can create side flexion. If it is contracting bilaterally, it will create extension. Next group of muscle is iliocostalis. We have iliocostalis thoracis, iliocostalis lumborum and iliocostalis cervicis. These also create extension and side flexion depending upon the bilateral contraction or the unilateral contraction. Spinalis muscle, spinalis cervicis, spinalis capitis and spinalis thoracis. Spinalis thoracis will create extension at the thoracic spine. Next group of muscle is called as transversospinal muscle. It is deeper to the erector spinae. The first group of transversospinal muscle is the semispinalis, which is superficial, multifidus, which is intermediate, and rotators are the deep muscles. Semispinalis we have three types, that is semispinalis cervicis, capitis and semispinalis thoracis. So semispinalis thoracis is responsible for extension and side flexion at the thoracic spine, whereas semispinalis and capitis which we have discussed are the extensors of the cervical spine. Next group of muscle is the multifidus muscle. This is collection of the muscle fiber. It originates from the transverse process of the vertebra to the spinous process of the vertebra located 2 to 4 intervertebral junction above. The multifidus will also create extension and side flexion depending upon the bilateral contraction or the unilateral muscle group contraction. Rotators are responsible for creating extension and rotation along with side flexion. So each fiber attached between transverse process of one vertebra and lamina and base of the spinous process of the vertebra located one or two intervertebral junction above. So there are two types of rotators, which are rotator longus and rotator brevis. Rotator brevis span one and the longest span two intervertebral junction while attaching to the base of the spinous process. So all these muscles act as an array of bilaterally matched guy wires specifically aligned to compress as well as control shearing force between the intervertebral junctions, stabilizing the vertebral column. So this was from the Thoracic Spine Biomechanics. You may refer these books, Kinesiology of Musculoskeletal System by Donald A. Newman, Kinesiology, the Mechanics and the Pathomechanics of Human Movement by Carol A. Otis, and Joint Structure and Function by Cynthia Norkins. So these books you may refer for detailed knowledge and more understanding of this topic. Thank you.